a baby can be exciting and a little scary. So today we're showing women what you need to know before getting an epidural. Nadia is due in just about 3 weeks, so pretty soon. And we also have Dr. Edna Ma here today, who's an anesthesiologist, and what a great name for a mommy to be anesthesiologist. So she's going to tell you everything you need to know. But I'm going to tell you a little caveat before that. What I have as a pet peeve as an OB is daddies who tell mommies they don't need any pain medication during labor, because if you asked a daddy to pass a bowling ball through his penis, I guarantee you he would want some pain medication. So just remember, you don't get any gold stars for being in pain. A lot of women in other countries who don't have epidurals at their disposal would just kill for epidural. So just remember, it's going through your body. It's what you want.
Don't have to be a hero.
Absolutely, absolutely. It's all about healthy baby and happy mommy, all right? So Dr. Ma will tell us exactly what you need to know for an epidural.
Well, when I tell patients to position themselves for an epidural, I have moms sit on the edge of the bed or have them lay on their side like this mannequin and then roll your back out like a shrimp. That really opens up the space in the low back. And this mannequin's on her side. And then what I do is feel for the bony parts of the low back, and you can feel it there. You can feel there's some...
Oh yeah, I feel that right there.
Then what we do is clean the skin off with the antiseptic paint. It's a sterile procedure. Then numb the skin up with some numbing medicine.
It's just a little tiny needle.
It feels like a poke in a
Yeah,
burn.
not any more than an IV.
And then we're ready for the epidural needle placement. And now with the magic of TV, we're going to take a look at what's going on inside your body. And this is the area that we're feeling for. Yeah, the bony spaces and the space in between is what we're aiming for. If you were my patient, I'd be taking this epidural needle and placing it between, feeling that area through the skin, and then introducing that needle. Now at this point, it won't hurt because we've already numbed up your skin. You'll feel some pressure of the anesthesiologist pushing against you, but nothing should feel sharp or painful. Once the needle is in a certain amount, you take the syringe, advance it a little bit more, and you may feel a pop sound. That means you're in the epidural space. Then we place a catheter in the epidural space when you feel that slight pop. And that tells us the tip of the needle is within the epidural space. We put this catheter through. It's a very, very small catheter. And if you look very closely, it looks like a slinky wound up very tightly. Then we take the needle out. The catheter stays in place.
Oh, it just stays in place.
It's very soft and flexible. We tape it to the skin, and then we take this catheter and infuse very dilute medications through this catheter. A lot of people don't realize this, but you can request to have a lighter epidural or have if you want to feel a little bit more of the contractions, just tell your doctor or your anesthesiologist, and they can adjust it based on your preferences.
So aside from, because I've heard about that it's harder to feel push, but also there's a lot of, I've heard there's controversy, with the medication going in. How will that affect the baby? Will the baby be more drugged when it's born? I know there's some concern
your baby
about
won't be more drugged because the medication is designed just to stay around the nerve roots, just where you're having pain from the waist down. So the amount that gets into your bloodstream is negligible, if any at all. That means the drugs don't cross over to the placenta and don't affect your baby. And the overall labor experience is a lot more pleasant for mom.
Right, and actually, and she's absolutely right, it doesn't cross the placenta, and that's why a lot of moms and dads don't want to, have the epidural, but it doesn't do anything to the baby. And actually, a lot of times it can help with pushing, because if you're in so much pain, there's no control, and that's when you do a lot of bad tearing, because when you can't listen to us because you're in so much pain. With an epidural, you can control that.
Dr. Lisa brings up a really good point, because if you didn't have an epidural, the stress hormones called catecholamines get into your body. Those cross the placenta and can make the baby stress before your baby's born.
So epidural is actually good for the baby.
Yes, because it reduces the stress hormones.
Do you have any other questions?
No, that's it. Thank you so much.
That's awesome. Well, thank you, Dr. Ma. And you're going to do absolutely fabulous. You got all your questions. She's just rocking.